Welcome back. I'm here with our expert, Dr. Christine Greiss, specialist in traumatic brain injuries at JRI, JFKUMC Medical Center. Dr. Greiss, welcome back. We discussed concussion, we talked about TBI, traumatic brain injuries, and now the most important segment, which affects most of us, especially elderly people like me, the cognitive age-related decline, the risk factors, dementia, CTE, and other related matters as we get older.
Thank you. This is a topic that's also near and dear to my heart. I always like to continue to discuss with people, with all of my patients, in terms of how we can improve and allow them to really live healthier and better lives. One thing that I will mention is we'll talk about CTE, and then, because it won't affect as many patients as cognitive dementia and the rest, but people understand CTE as a disease of many repetitive head injuries. And what I'm here to always say and clarify is that CTE is a diagnosis that can only be made post-mortem, so after death. However, we have a saying of CTE syndrome. And it
Can
really...
you just elaborate what CTE is to the...
Yes, so CTE is what we call chronic traumatic encephalopathy, and it is a neurological disease, or what we call neurodegenerative disease, where the brain at a very young age, young being anywhere between 50 and above, starts really declining cognitively, and emotional regulation starts being affected. We see a lot of patients that lose their memory, lose their ability to control behavior, and lose their ability to be able to even live with any of their loved ones in a normal community setting, and they need to isolate constantly. This disease occurs because a simple protein is deposited, and it's not a protein we want deposited in the brain, and that causes strangulation of the blood supply, and it fluctuates. So that being said, we tend to see these manifestations in those who have played contact sports for many years, those who have sustained repetitive head trauma, so constantly getting hit in a very short period of time. So usually in contact sports, the person is at risk for getting an impact every 40 minutes during the game. And so it doesn't happen in a person who's had maybe 3 concussions over 10 years. That we don't tend to see it. Okay. So that's that. As for cognitive impairment, now moving on to really the million-dollar question is risk factors. It's still really the same when it comes to managing health, obesity, poor lifestyle habits and not healthy lifestyle habits,
drinking,
alcoholism, drug use, any of the toxins that we put into our bodies can affect our ability for our nerve to function.
Sure.
What we do see in this day and age, because cognitive function is a very almost like the attractive strength of this day and age, because we're no longer cavemen. So we can't really show off our biceps or our lift and say, oh, we're able to move and lift this. That used to be a portrait of strength and health back in the day, not anymore. Sure. So how do we maintain that? Usually the best way is to improve and almost train our brains to do what technology is doing for us. It's almost also to allow our brains to expand in many ways in terms of thinking, decision making. Sometimes they say, in a simple game of chess for an hour, you can burn up to 150 to 200 calories.
That's right.
Why? Because cognition does burn energy too. We know very well that constantly training our brain for spatial awareness, not always relying on maps and navigation systems.
GPS,
Exactly. Those are the things that allow our brain to train and become better and expand more. And the likelihood of getting cognitive impairment as we age are much less. That's why there's no wonder that, people like you, Dr. Ratkalkar, are going to, it's an impressive thing because high level of education is protective against cognitive delay.
So you can still do executive
Decision
making
Yes.
while you're doing this. So as you said, music is another thing that is
Yes.
very, very helpful to keep this going, and any other things.
Yes, music, handedness,
right.
and so dexterity.
Dexterity,
Some, there's nice studies that show that even simple things as knitting, fine motor
Right.
regulation has
It
been
helps.
shown to help with the deepest aspect of the brain. That means you're allowing circulation to happen in the primitive brain itself, and that blood supply is regenerating and also regulating sleep.
So cognitive decline is not dementia per se.
Correct.
And dementia and Alzheimer's, they're a different category.
Yes, dementia and Alzheimer's. Dementia has many different forms. There's a Parkinson's dementia.
Right.
There's dementia just from other unknown causes, encephalopathic
body.
dementia. There's also vascular dementia.
Correct, which is more common.
Which we see as more common, correct. Those are certain genes that get turned on
Right.
because of our environment that we allowed to happen. So, and that happens also with lack of deep sleep,
Right.
which again, high states of anxiety affect deep sleep.
See.
And when one person doesn't go into that deep sleep and get at least 3 REM stages a night,
There is
then
trouble.
the chances of them retaining short-term memory are less.
Right. So that is somebody with obstructive sleep apnea who is not really treated.
Correct.
You will get all these things.
Absolutely.
So one of the examples of that.
Yes.
And Alzheimer's is a topic by itself. And if you can just share a couple of seconds or a couple of minutes on that.
So with Alzheimer's, we do get a gradual decline in cognitive function. Again, there are certain genes that turn on in the brain that this happens. It affects more the short-term memory first and the ritualistic behavior first.
Okay.
So it almost creeps up on people.
Okay.
What we see is a lot of that, problems, as families are the ones that tend to complain that they're not noticing their loved one.
So really, thank you, Dr. Greiss. And I must say that this has been a very informative episode. Traumatic brain injuries are real, and the concussion is real, cognitive issues and dementia and Alzheimer's dementia, they're all there. I recommend that anybody who has any questions or want to take help, go to our JRI brain trauma unit and the expertise of Dr. Greiss. It's a privilege to have you here today, and I hope you enjoyed this show. If you have any questions, please email us. We'll be happy to answer you during your next episode. Thank you so much.